Hi there, my name is Jen Crawford and I'm an Antenatal Ireland teacher based in Dublin, Ireland. Today I'm going to talk briefly about some of the pharmacological pain management options available in the Irish hospital system. You can look back over some of our previous videos that will talk you through different comfort measures you can use during labour and birth before choosing these options or in conjunction with, in order for you to have a positive experience. It's also helpful to look back over our video on informed decision making and the acronym BRAIN before you choose any pharmacological options. I'm going to talk briefly about the pros and cons involved in the three most popular pain management options: pethidine, Entonox or gas and air, and the epidural. Pethidine is a morphine-like narcotic. It is injected into a mother's upper thigh or buttock, and it takes effect within about 20 minutes, so it's very quick to take effect. It can be administered by a midwife, which means you don't have to wait for an anaesthetist or a doctor to come and administer it. It can help some parents to really relax, particularly those that have had a long predominant labour with lots of start and stop. It can also allow some parents the opportunity to sleep and rest. For some parents, when they take pethidine, they find it very disorientating, and that in turn limits their ability to move around and to adopt upright positions. It can make some parents feel very sick, and some will vomit a lot. For this reason, the midwife administering pethidine will also offer an anti-nausea drug that can help with that sickness. Another thing to bear in mind is that once a parent chooses pethidine, it takes effect for 2 to 4 hours. It also cannot be taken away because it's been injected into the mother's thigh. So if a mother takes pethidine and doesn't like it, unfortunately there's nothing that can be done. Another thing to be aware of is that pethidine does pass through to the baby through the placenta, and the effects of pethidine can be seen in newborns for up to 5 days. For most babies this is okay, but occasionally for some babies they do need to be admitted to special care baby unit in order to be monitored for their breathing or assistance with feeding. These effects should wear off within the 5 days, and it only normally causes issues if the baby is born within 4 hours of the drug being administered. The next drug I'm going to talk about is Entonox, which is gas and air. This is a tool that can be used in any position and anywhere. This means that you can use gas and air if you're in the shower or the bath or the birth pool. You can use gas and air in an upright forward position, or standing, or kneeling, or anything. Some parents find that the gas and air can make them feel a little bit lightheaded or dizzy, but what it does is it helps to change the perception of the contractions. It also helps to give focus on your breathing, so it can be really beneficial for a parent who's finding it a little bit hard to calm their breathing and take in those slow, deep breaths and allowing that breath to go out slowly. For gas and air to work, you have to take in those big, deep breaths through the contraction and then breathe it out. If a parent doesn't like how the effects feel, they don't like that lightheadedness, all they have to do is breathe the air around them for a few minutes and the effects will leave their body. It also does not pass the placenta to the baby, which means it's a very safe pain management option within a hospital system. The next thing I'm going to talk about is the epidural. The epidural is probably one of the most common pain methods that we know and hear about in the Irish hospital systems. The big pro, of course, is that for the majority of women it will take away all pain and sensation of labour and birth. It can help parents who are struggling with those sensations to rest and to get in the right mindset of becoming parents. It can also help parents to make informed decisions, as they can really focus their attention on what's being said to them. When a parent gets the epidural, it can bring many other things. So the epidural is an anesthetic-like drug that's injected into the epidural space in a mother's spine. When it's injected, there's a cannula left within that epidural space that comes out of the lower back and remains in place. This allows the parent to top up the medication as required. It also brings a cannula inserted into the parent's arm for IV fluids. This is because the epidural can lower a parent's blood pressure, so the IV fluids help to maintain a stable blood pressure. There will also be a blood pressure cuff on the opposite arm that will regularly take blood pressure throughout the rest of labour and birth in order to make sure it remains stable. Also, there will be CTG belts, which are the monitoring belts that come across a person's belly. It will measure the contractions and keep track of the baby's heart rate. With the epidural, it can increase the parent's risk of things like assisted birth, like vacuum or forceps, and it can also increase the parent's risks of a cesarean birth. For this reason, it's really helpful and beneficial if a parent, when they have the epidural, chooses to keep their pelvis open as much as possible, using a peanut ball or pillows between the legs and changing position as often as you can. I hope this video has given you a little insight into some of your pharmacological pain management options. There are many videos from Antenatal Ireland you can look back on to help you inform yourself as best possible for a really positive birth experience. Thank you so much.